Good morning and welcome to Wilder Foundation. We're just thrilled to have you all here with us this morning. My name is Bobbi Cordano and I'm the Vice President of Programs here at Wilder Foundation. Wilder's mission is to serve the vulnerable of East Metro, and we focus our efforts on serving children, families, older adults and their caregivers, and the communities through research and community engagement to solve social issues that our communities face. In the work that we do, we strive to be innovative, responsive, and effective. And one of the efforts that you are all here to join us in learning about the exploration that we have been on since 2010, when we established as a strategic priority under the leadership of our President, Mike Calhoun, a strategic priority on caregiving. And what we've done at Wilder is made it a Wilder-wide effort. And so joining me in our welcome this morning are two other vice presidents that I'm proud to have joined me, Paul Matesic and Kristine Martin. Our teams have been working since 2010 on this strategic priority. And one key part of this priority has been the engagement of community, and many of you have seen our caregiver campaign. How many of you are familiar with the caregiver campaign? That has now had 65 million impressions since it started, and so it's just a remarkable experience for us to be part of that journey. What you're going to be hearing about today is the effort of our caregiving strategic priority that's been really focused on the community engagement and research and learning about caregivers. And so we're very proud to be sharing that with you today. I've been asked to share a caregiving story with all of you, but before I do that, I'd like to ask how many of you in this room consider yourself a caregiver? It's fairly timely for me to have this event, and I didn't think I'd be emotional. I just had my life hijacked this last weekend by caregiving for someone who is not even related to me, and actually is a family friend who was a student of my father's, now maybe 60 years ago. And my father introduced me to this man when I moved up here 20 years ago, and his wife at that time, with the intention of making a connection in the deaf community for me with the man that he knew to take care of me if I needed anything, especially around the house if anything broke. And the real story is that I've been taking care of him and his wife for 20 years. So it wasn't exactly what my dad thought. I have had my life hijacked this past weekend because he had a fall. I have two children and a partner. One child is 14 and one who's 9. And Sunday, if you recall, was a perfect day. If we had had our regular family plan, we would have been at Taylor Fall hiking and enjoying the beautiful day that we had on Sunday. And instead, I spent my day at the hospital arguing, fighting, advocating, trying to figure out how to make sure this man who lives alone, who lost his wife a year ago, how he was going to go home safely, how they were going to make sure that they didn't release him prematurely from the hospital, that there was no way he could take care of himself. And so it's very poignant for me to think about the ebbs and flows of caregiving, and it's an unpredictable enterprise, and yet we all share that journey, and it's not shared enough, it's not understood enough, and the stories need to be told far more often than they are today. And I'm so proud to be part of the Wilder research team and effort and the community engagement team to really elevate this story that needs to be told and understood. And what we know is that when you have research and when you have engagement in research, we have a chance to to increase the credibility, and we have more data and more information with which we can use to change the way we work in our communities to support caregivers more effectively in the future.
In addition to my professional role at Wilder, I'm also a caregiver. I'm 50 years old. I have a daughter who just started at the University of Minnesota. She's 18 years old, and I have a 16-year-old son who's in the midst of his junior year, preparing for ACTs and all the demanding tasks that they put on high schoolers these days as they prepare to go to college. And I have an 87-year-old dad who lives in Washington, D.C. who recently fell several months ago and broke his femur, and in the process of repairing the leg, discovered that he had multiple myeloma. He has since been placed in a nursing home, the rehab section of the nursing home, the skilled nursing home. I'm learning all these words as I go along here. I have my caregiver network is my sister, who lives in Washington, D.C., and I have another sister in Atlanta. And how we've divided up the responsibilities of these caregiving duties is my sister in Washington, D.C. has really taken on the financial management, making sure that all the bills are paid and his house is attended to, and if there's a light that gets turned on, she runs over and makes sure that there's nobody burglarizing his home. And my sister in Atlanta is a doctor, so she's paying attention to all the medical interventions and the treatment for the cancer. And I'm out here in Minnesota, and I'm a social worker by training, and so I'm managing all the transitions, right? So what kind of facility should he be at? What's the safest facility? What's the cost of that facility? Or that transitions to a less restrictive facility. So how do we deal with Medicare? How do we deal with his secondary insurance? How do we make sure that all the home health care options are attended to? So you can see we've got 3 of us in different parts of the nation trying to manage an 87-year-old man who just 4 months ago was living independently on his own. As recently as 3 days ago, I just returned from Washington, D.C., where I go every 3 weeks. I recently returned, and on Monday I spent over 3 hours in meetings with social workers, with nurses, with rehab therapists, and on the phone with Medicare and the secondary insurance, trying to negotiate what all of these things mean and how to best help my family and my father make decisions for themselves. The final thing I'd like to say is that in our research, in my research, I discovered that there are actually care companies that have emerged over the last decade or 2 decades possibly. I don't know, because I'm relatively new in this world. And they actually have nurses and social workers that can do all of this work for you if your loved one is not in the vicinity that you are, or you don't have the loved one or the aging person doesn't have children who can help with the process. And so these caregiver companies provide all the things that my sisters and I are providing. The dilemma is that that caregiver company charges $175 an hour. Wow. So all of this incredible stuff that I'm learning as my sisters and I, kind of go through this journey of trying to help my father make decisions that are in the best interest of his life as he prepares, or as he goes through this recovery process and deals with the cancer diagnosis. And so I don't think my story is unique. I bet if I looked out over there and asked people to raise their hands, you probably would have similar stories or just as challenging stories. But it's a new era for me, and I think that's what this conference and conversation and research is about. So 18 months ago, the Wilder Board decided to make an investment in doing research and program development a little differently. So with respect to the Wilder values of responsiveness, effectiveness, and innovation, they invested some seed money in working across the organization with research, with programs, and with community engagement to engage community in co-creating solutions to complex social issues, much like the one that we're talking about here today. What we've learned through our development and discoveries with these initiatives is that we have found ways to challenge systems and systems practices. So we have an opportunity through these initiatives to look at system design and challenging and changing systems. We're discovering that there's really critical information that can inform policymakers. We're also learning that there are ways that we can change our organization, the ways that we do our own business, and provide programming. And we're really finding within the organization that there's a really keen opportunity to leverage the Wilder Foundation by creating that intersection between programs, Wilder Research, and Wilder Center for Communities.
I just want to make a couple points. I was asked if I would just make a couple remarks about research. And as it relates to this topic, one just interesting little piece of Wilder nostalgia that I want to bring up is that about 30 years ago at Wilder, we did a study of older people and their families in Ramsey County. And We did that study to understand something about the living conditions and needs of people in the county. And we thought we were pretty knowledgeable about how to design such a study. We got the study designed, we went out into the field, we were going to interview 1,200 people, or do a study of 1,200 people. We'd done about 100 interviews, and the interviewers were coming back and they were saying, you know, there's really something missing. You're missing an extremely important element of the lives of these people that we're studying. And it all had to do with the fact that they had identified a very large proportion of people in the age range of 60 and older who were being given care in their home by a family member. And this may seem like a really obvious thing to us now, but it wasn't so obvious 30 years ago. And in fact, what we actually did was go back and revise the survey we were using, and then with the remaining 1,100 or so families, we were able to understand, was there caregiving occurring? If so, who was doing it, et cetera, and it really enriched the study. I mention it partly just because it's an interesting curiosity of the past, but also a more important point that it makes is that we often do find important things from research, and research can be valuable in helping us to shape the direction that we are going to take with our programs, with our policy development. And that gets into the second thing that I wanted to mention, and Kristine already introduced this. It's the fact that Wilder is very interested now in what we are calling community research and leadership. And we entered this arena because, as all of you understand in this room, the kinds of issues that we face in our communities, whether it's caregiving or anything else, can't be solved in any single way. They require clinical and service approaches for people who need care. They require policy approaches in order to shape funding and systems to do the right things. They require preventive approaches to move upstream and influence the determinants of conditions that we may try to deal with in terms of services. And all of those approaches are critically necessary. In addition, it can't just be the organizations and the systems that undertake the work. It has to be the community. We have to engage people. We have to enrich the capacity of people to improve their lives and the lives of the people that they're caring for. And in order to do that well, it's not just a question of action, it's also a question of knowledge. And that's why we're experimenting and really seriously, intentedly trying to join community engagement with research, trying to inform action with good information. Many, many years ago, there was an equation that appeared in a magazine called Psychology Today. I don't even know if it's still around. But the equation was good intentions plus lack of information equals inefficient decisions. And what we're trying to say is let's capitalize on the good intentions that we have in our communities, that we as people who are involved in organizations trying to improve the communities have, but let's provide some really good information so that we can make efficient decisions related to the best kinds of services to deliver, the best kind of policies to develop, the best ways that we can increase the capacity of people to care for themselves and people that they love.